Hello, my name is Dr. Ian Hubbard. I'm one of the emergency doctors here at MVMC. This is Kelly, my technician, and our patient, Snooky. So today we're going to be talking about feeding tubes. So more specifically, this is a nasogastric feeding tube. So that means that this tube is essentially going down Snooky's nose into her esophagus and into her stomach. And this is something that we place on really sick patients that don't want to eat for us because it allows us to give them nutrition without having to force feed them or do anything else that's really uncomfortable for them. And this is something that is generally just going to be on our patients that are in the hospital. But you may, at some point, have a patient who is not eating at home that needs a more long-term feeding tube. And for that, we usually place a feeding tube in the esophagus, which is a surgical procedure. But the procedure for feeding an animal through an esophageal feeding tube versus an NG or nasogastric tube is fairly similar, and we're going to demonstrate that today. So, prior to feeding through a nasogastric tube, one of the things that we often will do is aspirate the tube, or essentially attach our syringe and try and suction a little bit on the tube, and that's to make sure that there isn't a lot of fluid in their stomach or gas in their stomach, because those are things that can make them a little bit more uncomfortable before we're putting more things down there. So we're aspirating, we're just drawing back on our syringe a little bit, and you can see there's just a little bit of fluid in there, and so that's normal. All right. Now, prior to putting anything down the tube, the first thing that we want to do is flush the tube. So we're going to use about 5 cc's of water, draw it up into our syringe here, and just flush that nice and slow down the tube. Now, anytime that you are giving anything through a feeding tube, it's important to go nice and slow, because if you go too fast, it can cause them to become nauseous, and that may result in some vomiting. So whenever we're giving food through a feeding tube, we always want to make sure we're using a liquefied diet. And so sometimes there are commercially prepared liquefied diets. In other cases, we can use canned food that's blended into a nice slurry. And we just want to make sure that it's thin enough so that it doesn't cause any clogs in the tube. Now, Snooky here has already been fed, so we're not going to do an additional feeding for him. But it's essentially just like with the water. You're hooking up your syringe to the tube, and then pushing the plunger nice and slow so that you're giving that food over several minutes, essentially. The other important thing is that you want to make sure that your diet is warmed up, because if it's too cold, it can cause them to become nauseous. So we don't recommend microwaving the food directly, because it can become too hot that way. But what we do recommend doing is placing it in some warm water, and that'll get it to a nice temperature that won't cause irritation or nausea for them. The other important thing is that after you give any diets down the feeding tube is to, again, flush it with water. And that is, again, just to make sure it's not getting clogged. So again, you're just hooking straight up to the tube and then flushing nice and slow. You want to make sure you're going in the correct port too. So otherwise it'll just come out the other side. And that's pretty much it when it comes to feeding through a nasogastric tube. Now, like I said, this is something that is going to be in a patient that is in the hospital, because it's just a temporary feeding tube. For more long-term solutions for patients that are not eating for an extended period of time, we will often place an esophagostomy tube. And that's going to look a little bit similar, but the tube is slightly larger. And instead of coming out through the nose, it's going to come out through a surgical hole in the side of the neck here. And that requires a little bit of care. They do have to have a bandage around their neck, and you do have to clean the stoma or hole every now and then, usually once a day. And the bandages do have to be changed about once a week or so. But it is a good long-term solution for animals that are not eating.